Good evening, everyone. Thank you for joining Congressman Frankel's virtual community town hall. We received hundreds of questions in advance, and you can submit additional questions live in the chat. If you'd like to submit a question live, you can type it in the chat section to the right of the video feed on YouTube, or if you're watching on Facebook, the comment section right under the video. We won't be able to address every question live, but we will do our best to answer as many as we can. Tonight, the Congresswoman will be joined by Congressman Greg Landsman from Ohio and Matthew Perkins, a local health insurance expert. Thank you again for everybody for joining us. I will turn things over to Congresswoman Frankel, and she will get us started.
Well, hello, everyone. Good evening. Hope everybody is doing well. I just want you to, if my background is shocking your eyes, just to let you know that painting is my hobby and it keeps me sane. So I wanted to share some of my doodles with you. There's going to be a lot to unpack tonight. We'll start with addressing the Americans' looming healthcare crisis and of course, the federal government shutdown, which has crossed at the same time. I have some amazing guests with me tonight who are really going to help us unpack all this. One of my favorite friends, all the way from Ohio, Representative Greg Landsman. Thank you for being here, Greg. Greg is a great guy, I will say that. But not only that, he sits on what's called the Energy and Commerce Committee, which is really one of the toughest committees to get on, one of the most prestigious committee. But what's so important for this conversation, it's the committee that deals with all our healthcare legislation. And for those of you who keep asking, what are Democrats doing to fight back? He will tell you about the fight that we're having. And Greg, I just want to let you know that we've had a series of town halls, and we've had Jasmine Crockett and Kathy Castor and Jamie Raskin and Stanfield. And so you're joining a great list. And I just want to tell my constituents out there, the reason I bring you my colleagues, because we are a team, and I want you to see the breadth of the members so that you could understand we're all in this together and we're really fighting hard. So Greg, thank you.
Thanks for having me. Thanks for doing this.
You're welcome. And we also, I don't know if Matthew's ready, but we're going to bring on, hi, Matthew.
Hello.
Okay, Matthew Perkins is one of our local insurance agents, and we'll bring him on to answer a couple of questions in a little bit. Matthew, thank you so much.
Thank you, Congressman.
For joining us. So I'm going to give a little background, then we're going to start to take the questions. Look, we have two monumental things happening at once. There's a need to reopen government, and there's a need to stop a healthcare crisis, which is right upon us. On September 30th, government funding ran out, and unfortunately, the Republican partisan budget to keep the government open would cause millions of Americans to lose their healthcare coverage because it fails to fund the extension of the affordable healthcare credits. And that's on top of what happened with the cuts to Medicaid. So what we're looking at is emergency rooms piling up, hospital and clinics closing, doctors not getting their bills paid. And then, as Matthew will explain to you, the effect of that on everybody else's premiums. This is a very big story. Why is this a very big story? Because there are 24 million people in this country on the Affordable Care Act, and Florida has the most. We have the most, over 4 million people. And the concern is that about 90% of these people need these federal tax credits, and their premiums are going to skyrocket. The premium notices are going to start going out. So Representative Landsman and I first, we are here to really say and make it clear that we are ready to get back to town. We want to negotiate with the Republicans to reopen the government and lower the healthcare costs. And Greg, at this time, I want to turn this up. I'm yielding to you. Give us your perspective.
Well, thanks for doing this. And Matt, thanks for joining. So, just to put this in context, and everyone knows this, but it's an important set of facts. The first being that the country is facing an affordability crisis, right? Like, people are working harder than ever. and it's becoming more and more difficult for people to pay all their bills, and the cost of food has gone up. The cost of essentially everything we buy because of Trump's trade wars, those costs are going up. The cost of housing has put, home ownership out of reach for millions, tens of millions of Americans. And then to make matters worse, a couple months ago, Republicans, in order to pay for tax cuts that mostly benefit the super wealthy, decided to cut over $1 trillion in healthcare to pay for those tax cuts. This is healthcare that Americans depend on, and they were able to get that through in a partisan way without a single Democratic vote, because they used a process called reconciliation, where you don't need 60 votes in the Senate. However, with the budget, you do need 60 votes. And so these budgets are negotiated in a bipartisan way. The challenge was Trump had told congressional Republicans, do not work with Democrats. And so they didn't. They listened to Trump, which is bizarre and unfortunate and unnecessary, and decided to pass a partisan budget that did not include any fixes to the healthcare cuts. So instead of saying, well, we'll just go ahead and vote to essentially permanentize these cuts and really hurt tens of millions of Americans, we're saying, no, you need to sit down with us if you want our votes, and you need these votes. And it's very simple. To your point, we want to keep the government open, or in this case, reopen the government, but we gotta protect people's health care, period. And so the president has said, why don't you reopen the government and then we'll talk. Here's the problem. They cut everyone's health care a couple months ago. They wouldn't negotiate with us before the shutdown. They won't negotiate with us now. So the American people aren't buying the idea that they're going to negotiate later. And it is urgent because the Medicaid cuts are looming. And you're seeing that take effect in places all over the country where hospitals are shuttering their doors. Long-term care facilities are laying folks off. Hospitals in general are just laying staff off because they know these cuts are coming. But the most immediate issue is the affordability of healthcare through the marketplace, commercial healthcare, where the government has given folks a subsidy, these tax credits, to help them pay for healthcare. And for 24 million Americans, those subsidies are going to go away January 1, but it's happening now because healthcare companies set premiums for next year, and they're sending out letters saying your healthcare premiums are about to skyrocket. And so we have to get a deal done now and reverse this. Otherwise, everyone is going to pay more in healthcare, everyone, because premiums are going to go up across the board. For 24 million Americans, they will lose their subsidies and they'll have to pay so much that millions of them won't be able to afford healthcare at all. 4 million at least will lose their healthcare. In the state of Ohio, 500,000 people will see their healthcare premium skyrocket. Now, that's happening now. And about 130,000 Ohioans will lose their healthcare altogether. Now, my districts, which is Southwest Ohio, Cincinnati, and the surrounding area, 32,000 of my constituents will see their premiums skyrocket. 14,000 will lose their healthcare. So I can't just vote for a budget that strips healthcare away from people. And all that has to happen is a very simple negotiation where we agree to extend these tax credits and stop potentially some of the Medicaid cuts that will happen now and reopen the government. I don't think we expect to get all of the Medicaid cuts. Some of those won't take effect until 2027. But for the things that are going to happen now, we have to get a resolution on it. Otherwise, people are going to lose their health care.
All right. Well, that's a good segue to bring in Matthew. Matthew, are you still with us there?
I'm still here, Congresswoman.
Okay. Matthew, quick background. You sell insurance, correct?
Yes.
Thank you. Give us, I'm sure you've been in some meetings with the insurance industry with your colleagues. Tell us what to expect the ramifications if these credits if we don't extend these tax credits with the Affordable Care Act? What do you see?
I mean, it's devastating. It's gonna devastate Florida very, very much because we have like 4.5 million people in the marketplace, and I have been in the insurance field since 2013, right before the ACA actually went live in the marketplace. So I've grown with it. I've seen this thing come around, and one of the best things that helped our country was when COVID was a horrible thing, but when these enhanced tax credits got put into place, it became the Affordable Care Act instead of the Unaffordable Care Act. For your middle class America could not afford a health insurance plan prior to that. And what we're seeing, and what I've already seen, a little bit of the inside is, a client that I have, a family of 3 is going to have a $1,200 per month increase. They're not getting tax credits. That is somebody who is off market, but that same plan at the same price is sold on the marketplace. So somebody who is not going to be eligible for tax credits in 2026 would see that increase in full. I mean, it's over the top, and it's we need help with this. And I thank you both for speaking out and being out here doing this, because it's gonna cripple it's a ripple effect as well. It's not gonna just hit these Floridians and Americans that can't afford their health insurance now. It goes down to the doctors, the hospitals, those Medicaid cuts you were talking about. So we are in dire need of these enhanced tax credits to be put in as law, extended at least for 2026 right now, because and it needs to be done quickly, because the annual enrollment, the open enrollment, starts on November 1st, and if it's the midnight hour, I don't know what will happen to the actual open enrollment period.
So Matthew, let me ask you this. I think one of the theories of the Affordable Care Act was to get as many people into the pot as possible. Do you foresee, for people who are not in the ACA, just they buy their insurance their self, what's the ripple effect, if any, for the rest of us?
Well, the healthy people are not going to pay those premiums, even if somehow they're able to afford it, because they're so exorbitant. So that pool is going to become a cesspool of all the unhealthy people that can't go without it. So they'll figure out a way to pay for that insurance, So it's gonna, and then those costs obviously skyrocket the hospital's costs, the insurance company's costs. So this is affecting everything, in a bad way right now.
Okay, because so ordinary healthcare costs are just going to go up. We get calls to our office, and just to give some examples, we got a call from a 63-year-old who has, her name is Francine, heart disease. She didn't have, before the ACA, she had no health insurance for 25 years. Today, she's paying $80 a month. And we were told that her rates could shoot as high as $217 per month, which would be completely unaffordable. We have another couple down in Boca. They have a decent. They between the two of them, they make $85,000 a year. She's had multiple autoimmune diseases. They pay $926 a month for their plan. That's a lot of money.
Yes.
We're told that their plan could go up to over $2,000 a month. Does those kind of numbers?
Those are accurate. Those are accurate numbers of what we're seeing with the preliminary, rates that are coming out, and that loss of that enhancement, because it affects the private and the on and off market, as we insurance agents call them. And some companies have the same exact plan. They sell through the exchange and just through the company. But if they're the same plan, the benefits are the same, and it's unaffordable. It really is.
Okay, so we have this. So as I said, two things are happening at once. There's a looming healthcare crisis, but we also have a government shutdown. And I know, Dan, we have some questions on that. Can you tell us some of the questions we have on the shutdown? If you're still with me, Dan? Oh, okay, there we go. He's writing it out. What exactly is a government shutdown, and who is affected? Do you want to take that? I think my friend from Ohio could help me with that question. Go ahead.
So government shutdown is when the Congress does not approve funding for the upcoming fiscal year, at which point the government has some money to do essential services because they have a contingency funds and those kinds of things. And some programs are funded outside of the annual government, the annual federal budget, like Medicare and Social Security. However, the folks that staff those agencies are subject to a government shutdown. The head of the Office of Management and Budget decides who's essential and who's not essential. The essential workers show up every day. Your troops and the TSA folks and air traffic controllers, and then the non-essential folks are furloughed and they have to go home. Whether you're essential or non-essential, you do not get paid. Now, that is something that the administration could resolve if they want to pay with contingency funds, air traffic controllers, and our troops. They can. We hope they do. But in terms of with that many people not getting paid, it's going to slow the economy down, which is bad. When you go to, use government services, they may not be available. And take a veteran, for example, who needs the VA, every day or often, they may not be getting the care they need. And so it's a huge problem, and it's one that has to get resolved sooner rather than later. We're talking days, weeks, not months. But this negotiation is probably, arguably, the easiest one if the president chooses to actually work and get involved. Because all we're saying is, we want to keep the government open. We wanted to. We wanted to avoid a shutdown to begin with. We just want to extend these healthcare subsidies and ensure that nobody loses their health insurance, and that we don't see people who are already struggling to pay their bills face even higher bills. So it's a pretty simple negotiation. And at the moment, Trump's position is still do not negotiate with Democrats.
Well, that's sad, very sad. I think a lot of people don't realize that our federal workers are all over the country, not just Washington, D.C. We have something like 95,000 federal workers here in Florida. And the concern is, of course, that when people are not getting paid, they're not paying their bills. And so, whether it's your cable bill or whatever, your dry clean, whatever it is, other people are being affected because you're not paying your bill. Now, I want people to know that eventually, we hope, in the past, the federal workers who are actually employed as federal workers got their back pay. Unfortunately, the president is threatening not to pay them. I don't think that's legal. But who has not gotten paid are what are called contractors. And I'll just give you an example. These are like the people, the custodians who clean the museums and so forth. People, or in the parks, people who are not necessarily full-time government employees, right? But they are employed. They are given contracts and they do a lot of work. There's thousands and thousands of them, and so that's why we need to get this done quickly. Premiums going out, and okay, we got another question here. What kind of premium increases might we be facing specifically? Well, Matthew, I think you answered that question. Was there anything more to that?
I mean, not really. If they don't, if we can't, you guys can't come up with an agreement for those enhanced, credits. I mean, what we're seeing with off-market people is minimum 30% of the premium, and that's like on the lowest end. Okay, and then you add lack of tax credits on top of that. Members can see their premium. We have a lot of members across the country right now that are enrolled through the healthcare.gov that have a zero premium silver plan. Fantastic that it's affordable copays. It's something that people can use. and actually go see the doctor when they need to, go see the specialist, get their prescriptions, because that's what this thing is about. It's about keeping America healthy, getting them healthy, not waiting till somebody needs the emergency room because they're dying or it's something that serious. And by taking this away, again, the marketplace is not open yet, so we can't say exactly what somebody's going to see in their premium 100%. But from everything we've been told, somebody on one of those silver plans in Palm Beach County could be looking from $0 to 80 to 150, and that's for one person. If they have a spouse, that could double that. So, and these are the things we've been told by the different carriers. So I think it's pretty spot on, because they're not going to try to scare off their membership by telling them their rates are going to increase like this, because that's self-defeating. So,
okay, well, what I want to just stress to everybody is this: we are in this together.
Yes.
It's not just 24 million people who will be affected. It's going to be the doctors, the hospitals, the emergency rooms, people being sick. Imagine if there's a pandemic, that would not be good. Greg, I know you were in the fight. Give a little insight or flavor to how the Democrats try to push back on all this.
Yeah, so this happened, all of this was put in motion a couple months ago with the one big ugly bill. I'm trying to rename it now because it was immediately unpopular, because the American people, they saw what was happening. It was $4.5 trillion that the Republicans and Trump wanted to spend. That was almost entirely tax cuts that mostly go to the wealthiest people in the United States, plus big corporations. And they had to figure out a way to pay for it. And they decided to do two things. One was to add trillions of dollars in deficit spending, or trillions of dollars to the debt. And then they cut healthcare by over $1 trillion. What they did on healthcare was to tell our committee, you have to find $1 trillion essentially in cuts. They did this. They cut food assistance and some other things, but the big cut was to healthcare. So Republicans had to find a way to essentially save $1 trillion in healthcare for the American people in order to pay a portion of their tax cuts plan. Now, when it came to them, I got to tell you, they didn't really like the assignment. I don't think they want to cut healthcare. I just watched them. We forced them to debate with us for 26 straight hours. So 26 straight hours.
And that means, and that's no sleep, because we have those committee meetings, right?
Yeah, so no sleep. And for many of us, we were engaged for 26 hours. Like, I did not stop, because they're reading the bill and some of the text for the first time. So we have lots of questions, and they can't close it until we're done with questions. And so essentially they did the following things. They said, well, these enhanced Affordable Care Act tax credits, let's get rid of those. 24 million Americans are going to lose these tax credits, and their premiums will go up. Number two, we're going to get rid of the provider tax that allows states to raise money for Medicaid. Three, we're going to start charging Medicaid folks to go see, to get healthcare. So they'll have these additional copays of sorts. And then four, we're going to add all this new paperwork for Medicaid recipients so that ultimately fewer of them get enrolled. When I asked in committee, I don't understand, that the vast majority of people on Medicaid are working. The paperwork requirements that you're putting in place have been tried in Arizona, in Alabama and Arkansas. Maybe Arkansas and Georgia, but in both states, all it did was take people who were eligible, who were working or looking for a job, and kicked them off the rolls. And I said, are you just trying to kick people off the rolls? And the answer was, we're just trying to clean them up. And so cleaning up the rolls for them means taking Medicaid. In their mind, Medicaid grew from just helping low-income people and those with disabilities to helping more and more people. And they want to shrink it back down. The problem is, because of the affordability crisis in the United States, you have a ton of people in states all over the country that have expanded Medicaid to cover people who any reasonable person would say, yeah, they need extra help to pay for healthcare. And it benefits all of us because it puts all of these healthy people in the insurance pool, and that will reduce costs across the board. The more people insured, the lower the cost. The fewer people insured, the higher the cost. And so ultimately, what they've done is created a plan that will pull healthcare away from about 15 million Americans. It will decimate, maybe that's too strong of a word, it will significantly deteriorate the healthcare system in the United States for everybody. And for what? Remember, they didn't do this for any other reason than to find cash to pay for these tax cuts.
And just to clarify, the 15 million number is the Medicaid, and then you have another 24 million on the Affordable Care Act, and then you got the ripple effect of that. All right. Okay, so that's all bad. Let's get another question here. Okay. Is it true that Democrats want to fund health care for undocumented immigrants? Okay, don't get over anxious. I'm going to read the question. Okay. Is it true that Democrats want to fund health care for undocumented immigrants with taxpayer dollars? That's James from Wellington. Well, I'm going to say categorically no, and I see, Greg, you're inching to go there.
Yeah, so they brought this up during the 26-hour debate, and we pulled out federal law, which stipulates that Medicaid dollars cannot go to undocumented citizens, to which they were very quiet.
Okay, this is just this. I don't like to be accusatory. It's just a lie. It's one big fat lie.
It is.
Right. Okay, Matthew, you're confirming.
Well, we can't enroll somebody into the marketplace who doesn't have proper documentation. Okay, so I've heard this so many times. So I'm tired of seeing it and hearing that it's all for the illegal, undocumented, people in the country, because you have to have documents to get Medicaid, to get Medicare, to get the Affordable Care Act. So yeah, and I'm glad that they helped us a lot. It was hard on agents when they made those. So they put some stops in the marketplace last year, and it did. It helped. They got that. In my opinion, they've taken care of that already. So that part needs to kind of quit being talked about.
All right. Okay. So that's one big fat lie. Okay. Dan, you got another question for us? Okay. Will the shutdown affect Social Security and Medicare? People should be getting their coverage for that. What may slow down is if you need to change something, change an address or get a new card or something like that. We may see a slowdown. I've heard from some of my colleagues that people are not answering their calls at the Social Security offices. We haven't had that problem yet here in Palm Beach County, so everything seems to be working in that regard. Greg, what have you heard?
Yeah, so Social Security and Medicare are funded separately. That's one of the reasons why they're still funded. And if you're on Medicare or you're getting Social Security, that should continue. However, to your point, if you need to make a change or something happens and you got to call somebody, it's entirely possible that they won't pick up the phone. So yes, we're working with a constituent now who had to change something with their Medicare and can't get anyone on the phone.
So, sometimes we have good news. I wanted, we'll see if it lasts, but in the Appropriations Committee, I actually passed a provision in the bill that said no money may be used to close Social Security offices in the country. So hopefully that'll stay in the budget when we eventually pass it. Okay, next question, Dan. The Democrats have a plan to end the shutdown besides waiting out the Republicans. Well, we've had a bill filed, actually. We have a bill filed that would allow the continuation till a certain date, till we can actually negotiate the budget. Keep in mind, folks, it's the entire budget is, we're talking about billions of dollars. There's something like 12 different bills. I mean, affecting all parts of life. So it's complicated. You don't do it overnight. And what we're arguing about right now is what's called the continuing resolution, which is to keep the government open until we can get worked out all the ins and outs of the budget. But we have presented our own plan. The chairs of our appropriations committee have we've presented a bill that would allow the government to open and that would pay for the extension of the Affordable Care Act. Unfortunately, we don't have the numbers yet in the House or the Senate, and of course we don't have the presidency. So, but we have loud voices, right? We have been. I will just say this: we debate in every corner, in every committee, on the floor, through social media, through events, through town halls like this. Many of our colleagues are in DC right now, trying to get the government open. Our Speaker of the House told everyone to go home, so there's no Republicans there in the House to even negotiate with. Greg, I think I summed it up. Anything else you want to say?
The only thing I would say is, we have a plan and a bill. So there's a bill that has been put on the floor 6 times now that would, to Lois's point, fund the government and protect healthcare. It was voted down by Republicans 6 times. So they could vote for that. The second option is one that is hopefully being, I know it's being negotiated between several members of the Senate. And, the Senate Majority Leader, John Thune, the Speaker, Trump, they're not interested in negotiating, which is slowing this down and making this much more difficult, much harder. But a few senators, I'll name 2, Lisa Murkowski and Jeanne Shaheen, are working with a few others to get a deal done. And it may be that they force Thune to get a bipartisan deal on the floor. And my sense is that the rank and file members of the House and Senate, 300 of us in the House, probably 70, 80 in the Senate, would support a bipartisan deal to reopen the government and protect healthcare.
Okay. Next question, Dan. Well, the VA is open, and whether or not, listen again. There's been some other issues with the VA, like very big cuts to all the services in the country. So, but right now the VA should be protected.
Yeah, the challenge with the VA is it's open, but a couple things. One is there are a lot of veterans who get their health insurance through the marketplace, and they will be impacted. Then there are a lot of veterans who need constant care, and they're not going to get constant care with the VA. It's open, but not the way it is when the government's funded.
Okay, Dan, next one. Okay, is it safe to fly during the shutdown, and will air traffic be delayed? Well, I can say I hope so. I mean, we've had this before. And listen, thank you to all the government workers who continue to work, and the TSA people, the air traffic controllers. They are very, very professional. So I want to say that and thank them. There have been this week, I do believe, some airports where there have been delays, and I think it's going to be depending on which airport we're talking about. I will say this, that in the past, one of the motivating forces that have gotten the Congress to reopen government has been the concern about air traffic and the delays. So when I say it's the good and the bad of it all, so that may add some pressure to getting this government open. Okay, next. Okay. Can federal workers currently on furlough actually be denied back pay? I'll yield that to you. that's an easy one. if you know what's in the president's mind.
Yeah, I mean, he can't legally do it. He's threatening to do it, which is just bullying. He's going to bully federal workers, Americans who are working for the United States government. Legally, he can't. Now, he could pay them. There are funds, or you could ask Congress to pay them. But, they seem to be determined to, fire as many Americans as they can. I mean, it's like 200, 300,000 people that they have gotten rid of. And, these are all folks, many of whom are veterans. These are all folks whose lives have been upended. But no, legally, he can't do that.
So legally, he can't. I will say this: if history, we know from history that the president has not has not necessarily followed the law. But I actually think that there are a lot of Republicans who would push back on that too. So we'll see because there has been a threat to lay off, and here's what our response has been. Since January, since the president took office, they have actually fired hundreds of thousands of government workers. So this is not a new threat. It is not a new threat. It's not one that it's not going to back me off. Okay. Next one, Dan. Yeah. If there's a natural disaster like a hurricane during a shutdown, well, we could be in a lot of trouble. We have hurricanes here. We have tornadoes. What do you have going in Ohio? Do you ever get any?
We get hurricanes. Yeah.
Get hurricanes?
Flooding too. I mean, it's hurricanes and flooding.
Yeah. Listen, I think everything's at risk.
Tornadoes and flooding.
Oh, you have tornadoes. Oh, you have tornadoes and flooding. Okay, I was wondering if you could take off one of our hurricanes, but
sorry.
Yeah, I think FEMA. I mean, FEMA is still there, and let me just say this: the president can designate essential whatever he wants.
Correct.
He can designate essential whatever he wants. There was a concern, and there's still a concern, that he may designate things that are essential to help certain parts of the country and not other parts of the country. So there's a lot of politics out there. But keep in mind that the main source of funding for the response is actually running low, and Congress needs to replenish the funds. That's why we really need to get quickly, not only to opening the government, but getting to a real budget. And just to add to the misery, already NOAA, which is the National Oceanic Atmospheric Administration that monitors hurricanes, they've already lost thousands of employees. That was before all this happened. All right, Dan, let's see if we can get a question with some good news. Okay, this is going to be for you, Matthew. Okay, signing up for healthcare on the ACA will be total chaos because what is being done at the last minute. When do you suggest we sign up for the marketplace, and what date?
That's a tough question because we don't really know. I mean, as of right now, we know the market's supposed to open on November 1st, but if a resolution comes and it's at the last minute, they may have to push enrollment to a later. They might have to adjust that or do something because things will have to be fixed, if you will, in the system. So because they're already preparing for no enhanced tax credit. So my suggestion, honestly, anybody out there who has ACA coverage or needs ACA coverage, contact an agent. They do not cost you anything to work with a licensed agent, or even they have certified application counselors out there, navigators. Work with somebody who knows the marketplace, because otherwise you probably will be dealing with that chaos. But the professionals don't charge anything. They're there for you, and utilize them because they're the ones who are getting trained every day and updated on how to deal with the changes in the marketplace this year.
So let me ask you this: I'm sure we have a lot of people on tonight who get Medicare. Do we expect those anything to change on there? Will people still have their coverage?
Medicare is going as planned so far. Right now, it's the annual enrollment marketing period. So people are talking to their Medicare members about
that goes from when to when?
So it's marketing from October 1st to October 15th. On October 15th through December 7th, you can start enrolling in your plans for January 1st. So we're here already in the season for Medicare, and everything. I don't, unless something happens with a new, bill or something, Medicare seems set for the year. So that's a good thing.
Okay. All right. Well, that's good. Okay. Next question. Oh. Okay. Are there any resources to help for federal government employees affected by the shutdown? Some of the unions, I know, are trying to help. This is a tough one. And, listen, I want for everyone who is listening tonight, I said we're all in this together. If you know someone who works for the federal government, reach out, invite them for dinner. See what you can do to help out. Maybe you can do some babysitting. Or what? I'm going to yield to you, Greg. What do you think?
Yeah, every district is going to be different, with the exception of what the unions or the federal public employee unions are providing. So my advice is, if you know somebody or you are somebody affected by this, call us. I mean, talk to your union reps. But if you don't know exactly who that is, call your member of Congress and see what they can do. I mean, our office is obviously going to help, but it's really important for those who are sort of standing in the way to also get phone calls to say, like, hey, I need help. And some districts are organizing local nonprofits, and while that's good and we're doing some of that, it does not compare to getting a paycheck. So people need
right. Depending upon how long this goes, there is always unemployment compensation. It's not very good here in Florida, I will tell you that. But I think I'm just hoping that it doesn't go long enough so that people have to do that. If you belong to a federal credit union, they have very, very low borrowing rates. So that's some good news. Next question. How much will Medicare supplements go up? Oh, Matthew, you have any thoughts on that?
That's going to be per carrier, based on how they do those rate increases. So once the carriers release those, you just have to check with each one to see how much, because doing this for over 10 years, over a decade, some years one company will go up 20% and the other one doesn't raise their rates at all. So Medicare supplements, you just have to check with the carriers as they release those for the following year.
So let me ask you this, because Medicare, if you're on the basic Medicare, that shouldn't be affected. There are a lot of people on the supplements, right? Because they want to get dental, or they want to get prescription, they want to get something else done. Do you think that if this is prolonged, I'm not, if we can get this taken care of quickly, it shouldn't affect it. But if the ACA situation is not resolved, do you think it could affect the supplements?
I don't think the ACA will have so much of an effect on the supplements, because that aging population, that they rate it basically on the morbidity and mortality tables on what's going on with that. So, but in the same respect, all the healthcare affects each other. So this ripple effect, if this ACA collapses within itself as it could possibly do without these enhanced tax credits, then yeah, it'll affect everybody. Medicare, Medicaid, it's going to affect the entire country, and more than just the healthcare, the businesses that supply the hospitals, the chain goes on and on. So it's going to be devastating to our economy in a way that you can't just say, oh, well, some people won't get a tax credit. That's not going to just be the end of it.
So a couple things there. You're just getting back to Medicaid a second. And one of the things that I am quite concerned about for our seniors is the Medicaid cuts. Medicaid is primarily used in the nursing homes. And I am very, very worried that we could actually see some of our nursing homes shut down. So we're going to be watching for that. And you mentioned something about the impact on the economy. I just to throw, I feel like when we get done with this thing, everyone's going to have to either take some ice cream or a drink, because I feel like this is not the best news. I wish I could. Well, I'm looking forward when I can give better news. But there is an economic impact of not extending the ACA. Just here in Florida, it's predicted that we would lose close to $5.5 billion in our GDP and 50,000 jobs, not just in the healthcare industry, but in all sectors, retail, real estate, and more. And we're projected to lose about $300 million in state and local taxes. So there is a ripple when people don't stay healthy, when people can't afford their own. And because think of it this way: if you have to pay more, let's say you say I have to pay more for healthcare, that means you have nothing to pay. You have so much less to pay for anything else. You have much less to pay for anything else. All right, let's go to the next one. Okay, let's see. Okay. Okay. All right. Okay, let's talk. First of all our teachers. Thank you so much for what I know. All of us will say we remember some great teachers, right? That got us where we are today. All right. I wish. Okay, there's another good, no good news, but I sit on the appropriations committee that actually funds the Department of Education, or what I should say was the Department of Education. The Trump administration has closed down the Department of Education. There's maybe 3 people left there. And there is, what is going on now is a movement to take public dollars and put them into private schools. That's exactly what's happening now. When we had a budget, we had a budget debate on the education budget, and there was a very, very big cut. So, but teachers, I want you to know we're fighting for you. I don't know if you want to add something, Greg, to that.
No, other than, obviously, state budgets do the heavy lifting in terms of funding schools and teacher pay, but you're seeing all over the country. I mean, the elimination of the Department of Education is one thing, and it's absurd and terrible and is going to be hugely problematic for the country. But it states across the country, in particular here in Ohio, there is, as you said, this move to shift money out of our public schools and into private schools. And it's part of a larger effort just to privatize, public goods, right? Like a public education is a public good. And this is one of the things that I think, we have to do a better job at as leaders, which is, envisioning an entirely, stronger, more well-funded public education system where we're putting more and more dollars into classrooms. And our schools need it, our kids need it.
Yeah, one of the reasons that the federal government started to spend money on education, because the states really are mostly in charge, is to look. There are lots of states and a lot of areas of the country where the states don't have, especially poor communities, and so the federal funds is supposed to be used to help the disabled, to the at-risk children, and also what's called the Pell Grants. They are significantly cutting the grants that help our young people go to college. And you want to add, what do you call it? Icing on the top or a cherry? It's not a cherry, it's a bomb. Then renaming them not the Pell Grants, the Trump grants. Give me a break. Anyway.
Is that true?
Yes, yes, it's true.
Oh, God.
Sorry.
More good news.
Oh, here's a good. What is the status of the Epstein files? Mark wants to know. I'd like to know that too. So here's where we are. Incidentally, Greg, I don't know if you know this, and Matthew, but the people here in this community, this is personal to us.
Yeah.
Because the bad deal for Epstein happened here in Palm Beach County.
Right.
And I read the grand jury proceedings here, and I am mortified, I am embarrassed, I am ashamed what our state attorney did, treating the victim. In fact, there were like dozens and dozens of victims, and they brought in one or two, and they treated them like a prostitute. And then they charged Epstein with soliciting prostitution. Can you believe it? Put him in a jail cell. He had got a double jail cell.
When they knew they were 15, 14, 15.
They knew. And he was allowed to go to work every day and abuse more people. And I will tell you, it was the Palm Beach police chief, kudos to him, who first brought this to the prosecutors. And he fought like hell, I will say this, to try to get the prosecution. And just so people know, many years ago, when I was chair of the Women's Caucus, I actually led an effort to get an oversight hearing here in Palm Beach County so we could get to the bottom of this. And we were stopped by the Justice Department at the time, only because they were prosecuting Maxwell and they didn't want us to interfere. So that's fair enough. So I want it released. I know, Greg, overwhelmingly the people in this country want these released. Where we are is this. In the House, I speak for the House, not the Senate. Well, we have a discharge petition. I'm going to let Greg tell you what it is. And then what I was going to tell you is once we get it passed in the House, if we do, then we got to figure out how we get it passed in the Senate because they need 60 votes. But Greg, explain the discharge petition. What's going on?
There's a rule in the House that allows the members to force a vote. Otherwise, the Speaker has in full discretion as to what comes to the floor, meaning that even if Committee X passes a bill out of the committee, sends it to the floor, it sits with the Speaker until the Speaker decides whether or not he or she wants to actually vote on it. And last year, there were something like 700 bills that were voted out of committee that never made it to the floor. That's how unproductive and partisan last Congress was. This Congress is shaping up to be even worse. So there is a mechanism, and we used it last year to force a vote on the Social Security Fairness Act. That was something I fought for with Abigail Spanberger and Garrett Graves and a few others. And we got 218 signatures in 2 days. And we ultimately got a vote and passed it in the House and the Senate. And it's $20 billion a year that's now going to public retirees, teachers, firefighters, police officers, letter carriers. It's a huge deal, $20 billion a year that the federal government was stealing from these public retirees who had paid into Social Security, but because they had a state pension, the law said you can't have your Social Security. We changed that through a discharge petition. There are currently 217 signatures on the Epstein discharge petition. It would require the release of all of the Epstein.
We need one more. We need one more signature. And
yeah.
Yes, go ahead. Well, we had elected the 218th signature, which a woman just elected in Arizona, and the Speaker's refusing to swear her in.
So just on that, how unprecedented this is. This is also very, I think, interesting. The United States Constitution requires that Congress be in session a certain number of days every year. And since we're not always there, they do what's called a pro forma session, where they gavel in, they do the Pledge of Allegiance, somebody does a prayer, and then they gavel out. And that counts as a day. If you don't hit the number of days consecutively, you have the session ends. And it becomes very problematic. So there's a pro forma session most days, and there's one tomorrow at 3 p.m. And this new member is in DC, and she has said, swear me in. Last week, we all went to the floor. There were about 200 of us. They walked in, they opened it up, and we said, swear her in. And they gavelled out immediately and literally scurried off the floor. And so tomorrow, it's going to happen again, where at 3 p.m., they're going to gavel in. And every time that there's been a new member, because the House of Representatives is the only body where you have to get elected. You can't get appointed. And so anytime a member is a position is vacant because of retirement or a death, there's a special election. And then usually within a day or two, either in a regular session or pro forma, the speaker swears that new member in. He refuses to swear her in.
Yeah, and because we know what's happening is there are about 4 Republican signatures on this discharge petition, and they are beating them up, I'm sure, as we speak. All right, so status of Epstein files. The majority of Americans want it, and obviously our president doesn't want it released, but we're going to be fighting hard so everybody can see what's in there. Okay, I think we're okay. All right, so, okay, this is what are Democrats doing to fight back against this madness in Washington? I hope, folks, that you could tell a little bit from this discussion that we have rolled up our sleeves, and I will tell you this. I wish we had the majority. If we had the majority, folks, we could be doing a lot more. That's why we got to win this next election and flip it. But I will tell you this, and Greg, this is my way to thank you again. Representative Landsman is an example of what I think is the brightness, the articulate. Is that a word? Articulate. Articulate fighting spirit of the Democratic caucus. And there's like, what, 215 of us now? And I will tell you, folks, just to let you know, every single day we are fighting, whether it's in the committees or on the floor or in the social media or in the town halls. You want to add something back to that, Greg?
I mean, this fight over the shutdown is us saying no more. It is really hard for people like Lois and me, any of us, to not fund the government. And it would be, I think, even worse for us to fund it. It would be a status quo budget or continuing resolution where millions and millions of our constituents lose their health care and their costs go up even more and they go into greater debt. It's just not right. And so, that's what you're seeing. You're seeing us fighting back.
All right, Dan, as we wrap up, you have anything else for us? I think we're getting to we're almost at 6 o'clock. What else do you have for us today? Okay. Many have asked, what can we do to push back against the Trump administration? Okay, well, I know there's going to be a big rally here, right? There's big rallies across the country in a couple of weeks, but here's what I tell people. First of all, there's so many ways to push back. First of all, help your neighbors, help your people who are in trouble. The food banks are going bare because of Republican cuts. There are a lot of people out there, Planned Parenthood, federal government cutting off them. There are a lot of charities, organizations that you can roll up your sleeves, and whether you'll be a volunteer or you make a contribution, that is a way to push back. And then, of course, there are other lawmakers, right? Call us. Let the phones ring. Whether you're calling us or you're emailing us, let us know. And in every way that you feel is appropriate, push back. Whether it's on your Facebook page, your Twitter, what are all the different things people do? There's a lot of social media out there. Talk it up. Let your friends know. I think having people be informed is so important. Get ready for the next election. In Florida, make sure you resubmit your request to vote by mail if that's what you like to do, because Greg, and after they throw everyone off of vote by mail every 2 years, okay? So you can do that. There's a lot of ways to be an activist, and let's face it, folks, we got to save our country. There's a lot of bad things. We didn't unpack it all tonight, did we, Greg? We didn't unpack it all, but folks, we'll have another town hall. I'll have another spectacular guest. You have been spectacular, Greg, and so have you, Matthew. You've added a lot tonight. I want to thank you so much for joining us. Did you want to add anything to the fight, Greg?
I just wanted to say thank you for having me here, both of you. Sorry.
What?
No, I'm really glad that it was really helpful, Matt. I just, you know, I especially this advice is just call a rep. And I'm assuming you can, you know, find one. If you don't have one already, just go online and
you can check through even the marketplace. You can request that an agent calls you right on the healthcare.gov. There's a bunch of ways that you can go about it, and they'll find a local one. But yeah, utilize those resources, because that's, you know, just as you said, education, you know, you mentioned that, Congresswoman, and it really is, especially with the insurance too, is educating your member so they know what they have, and utilize somebody who knows you know, how to explain it to you, because it doesn't cost you anything and you'll get the coverage you need. And let's hope it's affordable, because we get this new budget passed.
Yeah, and folks, just to let you know, my office, regardless of whether we're shut down or not, my office is open every single day for you. So please don't hesitate to reach out. We're here to help you. Everybody, thank you for joining us tonight. Again, thank you, Representative Landsman. Thank you, Matthew Perkins. You made this a very special night.
thank you, Congresswoman. Thanks, Matt.
Thank you.